Puerto Ricans and type 2 diabetes.
Diabetes is a disease where your blood glucose, also known as your blood sugar, is too high. This can be because your body isn't producing enough insulin or isn't producing any insulin at all, or the insulin that your body is producing isn't doing what it should be doing. There are two types of diabetes. Type 2 is the most common type of diabetes. 95% of people who have diabetes have type 2. There is a genetic mutation involved, and you must have this genetic mutation in order to develop type 2 diabetes, but researchers haven't been able to pinpoint the exact mutation. Lifestyle also plays an important role in the development of type 2 diabetes. This includes diet and exercise. Most people with type 2 diabetes are insulin resistant, meaning that their bodies do produce insulin, but So what is insulin? Insulin is an important hormone that is produced by the pancreas. When you eat sugar and starch, the stomach releases glucose into the bloodstream. This prompts the pancreas to release insulin, which acts like a key to unlock the cells and allows them to use glucose as energy. Without insulin, your cells would not receive energy from glucose and there would be too much glucose in the blood. Now that we know what diabetes is, it's important to be able to recognize it. Listed are the most common symptoms seen in diabetic patients. They urinate frequently because when there is excess glucose in the blood, the kidneys try to flush it out through urination. The frequent need to urinate leads to dehydration, which causes thirst. They feel hungry even if they ate because food cannot be converted into energy. They feel extreme fatigue because they are not receiving energy from glucose. They can have blurry vision because high blood sugar causes fluid to leak into the lens, causing it to swell. They can also have slower healing wounds. It's important to remember that these are only a fraction of the possible symptoms. On the other hand, there can be no symptoms at all for many years. So what increases your risk of developing type 2 diabetes? Being overweight, having a family history of diabetes, and stress are some examples. The first, and arguably the most common way of getting type 2 diabetes is being overweight or obese. Although it isn't completely understood why this causes type 2 diabetes, one of the theories is that fat cells release pro-inflammatory chemicals that make the body less sensitive to the insulin it produces. Fat distribution is also important. People who carry most of their weight in their abdominal section are seen to have a higher risk of developing diabetes. Another thing that increases your risk of developing type 2 diabetes is having a family history of diabetes. Although it's possible to have the mutation without any family history of diabetes, people with a family history should be particularly careful. For example, if one parent has type 2 diabetes, his or her children have about a 40% chance of developing it in adulthood. If both parents have it, their children have up to a 70% chance of getting it. This one might come as a surprise, but prolonged stress can increase your risk of developing type 2 diabetes. The stress response, also known as the sympathetic nervous system or fight or flight, produces a number of hormones that prepare the body for fighting or running from a threat. Those hormones, such as cortisol, increase blood sugar, blood pressure, and insulin resistance. People who face more threat, have unsafe living situations, face discrimination, or generally have more stressful lives have a higher risk of developing type 2 diabetes. Also, ongoing stress can cause overeating and underexercising, which can also lead to diabetes.
15.7%. This is the percentage of the Puerto Rican population that has type 2 diabetes. Additionally, it is estimated that up to 6.3% more people could be living with type 2 diabetes without knowing it. This translates to around 400,000 people who knowingly have diabetes out of the population of 3.3 million and around 200,000 more people who have diabetes but aren't aware of it. How does this number compare to the continental United States? The percentage of people with type 2 diabetes in the United States, for comparison, is 9.3%. This means that Puerto Rico has at least 6% more known cases of type 2 diabetes than the rest of the United States. So, what puts Puerto Rico at a higher risk? Stress due to poverty and diet are two factors. Well, according to the United States Census Bureau, in 2015, 46.1% of people living in Puerto Rico were living below the poverty line. Puerto Rico's financial situation has led to budget cuts, which have only worsened conditions for the people who were already struggling financially. In order to pay off the debt, Puerto Rico has delayed tax refunds and payments to suppliers, cut budgets on healthcare and public transportation services, closed schools, and increased sales taxes. All of these things can cause a great deal of stress, which, as we've learned, contributes to the onset of type 2 diabetes. Also, another thing that puts Puerto Ricans at a higher risk of diabetes is their diet. Listed are some staples in the Puerto Rican diet. Rice, a starchy carb, is popular in Puerto Rico. Plantains and potatoes are also popular. When it comes to dessert, the Puerto Rican diet includes different cakes and pudding. None of the things on this list have to be completely avoided, but they should be limited. The first thing is starchy carbs. Examples of starchy carbs include bread, potatoes, pasta, and rice. Animal protein should also be limited. Many physicians argue that animal fats can cause diabetes by blocking cells' insulin receptors. Last but not least, trans fats from partially hydrogenated oils should be limited. This includes fried food and packaged snacks, among other things. As we learned in the last slide, the Puerto Rican diet is heavy on all the things on this list, putting them at a higher risk. So, how is type 2 diabetes treated? Since diabetes is partly genetic, there's no way to completely get rid of it, but fortunately there are ways to control it or go into remission, which means getting rid of all the signs and symptoms. The main way to control type 2 diabetes is through diet and exercise. Following a healthy diet allows diabetic patients to keep their blood glucose under control. Exercising allows your muscles to become more sensitive to insulin and absorb more glucose from the blood, and it also decreases blood glucose levels. Diet and exercise combined allows diabetic patients that are overweight to lose weight, which can bring their blood glucose levels back to normal range. Some people with type 2 diabetes can control it with just diet and exercise, but others need medication too. Their doctor may prescribe oral medications that lower blood glucose levels or insulin injections, which work the same way insulin works in the body naturally. So, how can you prevent developing type 2 diabetes? The only way to prevent it is to live a healthy lifestyle. A healthy lifestyle includes, but isn't limited to, proper nutrition and exercise. For proper nutrition, it is important to include low-fat, nutrient-rich foods, like whole grains, fruits, vegetables, dairy products, and lean proteins into your diet. Also avoid overeating by watching portion sizes. When choosing your meals, MyPlate is a good guide to follow. Another way you can prevent type 2 diabetes is with exercise. Just 30 minutes a day, 5 times a week can help a lot. Remember, this doesn't necessarily mean that you have to get a gym membership. There are ways to exercise and have fun doing it. Some examples are joining a dance or martial arts class, hiking with friends, or playing sports.